Hi, my name is Angela Hunt, and I'm a naturopathic doctor here in Hamilton, Ontario. A naturopathic doctor essentially is someone who treats the root cause of illness. So I do this with natural therapies from clinical nutrition. My focus is really food as medicine, using vitamins and minerals, clinical nutrition, really focusing on food as medicine, but also using plants and exercise and acupuncture the entire time, building a treatment plan that has the patient at the center. The reason I got into naturopathic medicine was probably because of my upbringing. I was raised in the countryside in the St. Lawrence, Thousand Islands area. My parents really had the idea that we're very connected with nature and it has a lot to teach us. So that was a big part of how I was raised. On my graduation, my grandfather actually told me a story about my great-grandfather, that he was a little bit of an alternative natural healer himself, and people used to come and visit him to get medical advice. And one day these gentlemen came from New York State with a very sick little girl, and he cured her using natural therapies. So as a reminder of this, my grandfather took the payment that they gave him, which was a little hatchet, and he mounted it for me, and it sits in my office, scaring some of my patients, but once they hear the story behind it, they usually come out with a smile. A big misunderstanding with naturopathic medicine is that it is not scientific based, which is completely inaccurate. Every clinical decision I'm making, from nutrition to exercise to what supplements to give someone, I'm researching that. I'm using science to help me make better decisions. So just because I don't use pharmaceuticals doesn't mean I'm not using science. It's also important for people to know that I'm not against pharmaceuticals. Yes, I use natural therapies in my medical practice, but I appreciate that pharmaceuticals are absolutely life-saving at times. I think it's important for people to know that they have other options. For one health problem, there's a lot of different solutions, and naturopathic medicine offers a lot of solutions. So I think it's important for people to be informed of their options so they can make a decision that makes sense for them. I get to spend a lot of time with my patients, which is great because it allows me to take this very holistic approach and really get to know them on a very personal level, understanding their sleep patterns, their diet, their stress levels, and then I can build this individual personalized treatment plan for them. It's truly patient-centered medicine, which is very effective. In my clinic, prevention is key. Taking a proactive standpoint towards health instead of a reactive standpoint, I think is where the future of medicine is going. So when you sit down with a patient, I'm looking at their comprehensive blood work, their family history, a complete physical exam, and as well as genetic risk factors. And then I'm building this health program that will hopefully decrease the risk of getting those potential diseases. So instead of treating heart disease, I'm trying to prevent it from even happening in the first place. This is very exciting medicine, and I'm very thrilled to be part of that.